Hi, good afternoon, and welcome to IoT North's Food for Thought. Today we were hoping to have a chat about using IoT for human predictive maintenance, helping us with health. Before we get into that, I'm just going to stall because one of our attendees is running a little bit late. We have the IoT Solutions Marketplace. If you'd like to check that out, it's iotnorth.uk/marketplace. Just quickly share the link for that for you. And we also have the forum, which is forum.iotnorth.uk. Get together, have a chat. We're a community here. It'd be great to hear from you. If you have any ideas for shows or if you'd like us to help you in any way, please do get in touch. And as if by magic, our guests have now arrived. So today we have Hatice from IVDY. She's the CEO there. And then we also have Colville Wood from Cognizant, who's CTO there. Hi, Colville. Hi, Hatice. How are you doing?
Good, Paul. How are you?
Very
Hi,
good. Hatice, calling you fine on that one.
Hi, I'm doing great. How are you?
Yeah, I'm good, thanks. I'm good. Hatice, would you like to introduce yourself to everybody?
Yeah, sure. Hi, my name is Hatice, and I'm CEO of IVDY, and trained mathematician and working in the healthcare field since 2009, actually, creating some predictive methods for diagnosis. And IVDY is a new venture of mine, and I'm excited here to share some of my experiences and have an exchange.
Awesome, thank you. Colville, good afternoon. How are you, sir?
I'm good.
You're good. Would you like to introduce yourself to everybody, please?
Yeah, sure. So I'm Colville Wood. I'm CTO for Cognizant's UK and Ireland insurance division. A long history in technology and building solutions, particularly for insurance, but not exclusively. And a lot of interest at the moment from that industry in IoT, how it can help prevent risk, reduce premiums, and improve the service that insurers offer. So always interested to talk about IoT and new technology and how we can help that industry.
Awesome. Great to have you both on the show today. Thanks very much for making the time. So let's jump straight into it. How can human predictive maintenance be enabled? Hatice, would you like to take that first?
That is a very broad field of discuss, and there's a lot of moving parts that comes into this. One way would be to use the information from the patients directly to and connect this with the doctors, so help the doctors with their diagnosis, particularly by giving them the option or helping them with solutions with the data. So and IoT plays a big part of it. For example, if you want to help to predict some cardiovascular events, then you can use some wearables, like different kind of wearables, to collect all the information directly from the patient, the vital information, and use them to generate like an overview of the healthcare from patients, and give the doctors the opportunity to get a prediction from events maybe early on by just seeing or going through the healthcare data of the patients. Mm-hmm. And what we usually try to do is also to build an data ecosystem where you have all the information from the patients connected. So you have the entire history of the patients, and all information flows into the decision making for the doctors to support them.
So is this something, Colville, the UK is a little bit different to predominantly the rest of Europe and the world in regards to the public health care that we have and the mass that it has. Does that create a bit of a challenge in adoption? Is this something more for private healthcare that can adopt this rather than public healthcare, do you think?
It's good. It's a really good question. I think that if you look at one respect, the NHS in the UK, we know it has funding difficulties. It's very expensive, and there's as an organisation, it needs to find ways to reduce its costs, and prevention of illness or predicting illness, preventing risk to the population. There's obviously a way in which you can reduce the cost by intervening earlier or avoiding something altogether. So I think in terms of the public health, there may actually be a stronger case in the UK to advocate predictive medicine and predictive intervention. In the private space, I think, I mean, there's a similar thing. There's a similar pressure on costs, and as the pressure builds on the NHS, then some of that is going to be transferred into the private healthcare as well. And we know that successive governments have looked to increase the amount of spending that's done directly into the private sector or subcontracted through the NHS. I know there's a bit of a reversal on that at the moment. Mm-hmm. But I think the private healthcare in the UK is probably limited because it's such a small scale, because we're dominated by the NHS. But we can take things particularly from the US and European markets, and I think that's the way in which they'll come into the private healthcare.
Yeah. Then comes to the challenge of who owns the data. So, for example, I'm type 2 diabetic, with asthmatic and all sorts of other things as well. I'm monitoring my weight and everything. I'm using connected scales, blood pressure, everything to my iPhone, and I've offered that data to my doctors. They won't take it. Even like the weight and everything like that, I've got to go to the doctor's surgery to get done, which just seems kind of ludicrous. So is that one of the inhibitors and challenges in regards to the data access? There seems to be a bit of a disparity on the NHS and private healthcare as well, because I have chatted with a couple there on if they provide you with the device, they'll happily take the data, but if they don't provide you with the device, they seem to be a little bit reluctant on that. Have you come across that, Hatice?
So how is it in the UK with the data itself? Is it also already all digitalized and connected with the doctor's offices, or do you as a patient have access at all or not?
You do have access in the UK to your own medical records. Mm-hmm. And most practices will offer digital versions of that.
Okay. Can you repeat the question again? So
Sure. So with your experience in regards to the data being collected, who's providing the devices to be able to collect the data? Have you experienced people being able to take data from devices that are from other providers or somebody who's purchased themselves into the healthcare?
Usually, in my experience or in my portfolio, we usually have the doctors directly giving the patients the medical device. They are so medical devices from the doctor. If someone has some issues with their cardiovascular system, they have like different kind of devices that is from the doctor itself, and their measurements of those devices, they are more accurate because they are made just for the medical purpose, and it's not like the regular smartwatches who collect a wide range of data, which is most of the time not really usable for the medical predictions or medical data.
Yeah. So Jonathan, thanks for the question. Jonathan's just raised. So consumer collecting devices are not used for medical analysis? Question mark. From my personal experience here in the UK, no, they're not. How about you guys? What have you seen?
From an insurance point of view, and in the healthcare industry, wearable devices are used to track general health, but they're not being used for detailed medical analysis. But just going back to the last question, Paul, I think one of the key things, particularly in Europe, is GDPR legislation, and that's about consent. So data processors have to be really careful that they have consent to use health data because it's personally identifiable and sensitive. So in that case where you're offering your data to medical services, that your consent really needs to be tracked through to the use of that data. And I think that's why when medical specialists are giving out devices, they can talk about consent, they can ask for consent, and you've got that all within that process.
Yeah, I think yeah, that's a very, very valid point. Although it's sometimes also just creating that connection between the GDPR approval on your smart device, giving it to that third party, which you quite often get adding different devices to, for example, Apple Health. You have to give that access, which theoretically you could be doing for the medical providers and such like, so they can use that data. Theory. Jonathan's just asked another question as well. Does this link up with what companies such as Philips are doing, linking all their medical devices together to stream information and help predict or avert a situation? Do either of you have experience with the Philips?
So I'm not aware of what Philips are doing. I can't comment on that.
Jonathan, if you could share some more insight, that would be great. Jonathan, lots of questions from Jonathan today. Is there a gap between what medical devices collect and consumer devices collect? Yes, there is in regards to the access to the data and the approval there, as we were just having a quick chat about there. What are the risks for patients being monitored and their data being collected? Colville?
I mean, from an insurance point of view, which is where I look at this, the risk is potentially excluding people from insurance for their data. I mean, this is a conversation that's gone on within medical and health cover for a long time, since we had kind of genetic screening and that ability for insurance companies to look at your medical data and decide whether to insure you or not. So I think there's a risk that we could end up with part of the population being excluded from certain insurance because of their medical conditions, or not having access to the devices that would then allow them to be insured.
Yeah. Can you tell us about IVDY and what you do there and what you help with?
Yeah, so what we are trying to do, or what we're doing, is build a data ecosystem that is usable for the medical risk prediction. So it's more focused on collecting and getting the right kind of data that helps doctors with their diagnosis process, instead of collecting data which randomly, which go more towards like how's it called? Like categorizing patients for the insurance purpose. So we are building an ecosystem that is connecting directly to the medical knowledge that the doctors can use for the diagnosis process itself. So the data is being collected with very specific, I want to say filtering, it's maybe not the right word, but get them in a standardized format that it can be used directly for the diagnosis and decision making. So it's firstly tracking the information of the patients, which is the medication they take or the surgeries they have. So directly related to the medical information, and then use that kind of information for the disease prediction, and not try to go the way to categorize patients for the insurance predictions. So the words are missing. because there's also like for the doctors, they need certain quality of medical standard of medical information that they can rely on the prediction that those predictive models are making for their decision making, for their diagnosis process. So we built a data ecosystem which is going more like targeted more on the medical knowledge, and that can directly be used for the diagnosis process.
The devices that the doctors are already using.
Paul, I think we lost you. We lost the start.
I think you lost me there. Am I back?
Yes.
Sorry, I was saying, so you're using the devices that the medical professionals are already using. You're not providing devices.
We're not the direct providers of devices. We collaborate with some companies who do that, but we are not the direct device providers, no.
Okay, brilliant. Hey, guys, I think that wraps it up quite nicely for us today. Thank you very much for your time. It's been an absolute pleasure having you on online, and all the best. Okay, so next week we have Jordan Appleson from Hog Systems joining us, talking about how smart is retail with IoT. These guys have got some phenomenal success and experience with that space. On that, thanks very much, and look forward to seeing you next week. If you would like to be on a show, please do get in touch. Thanks now.